Well, a dental implant is basically a replacement tooth root. So a dental tooth has the root that goes in the jawbone, and it has the crown that goes above the jaw, and that's what you chew with. So when we're replacing a tooth with a dental implant, we're going to replace the root with the implant, and then we're going to place a crown with it on top so that you have full function again. The advantage of having a dental implant is that it can take the wear and tear and chew just like a natural tooth. Other dental prosthetic options such as bridges or removable dentures, you don't have either the chewing force or you don't have a long-term prognosis where you can have a dental implant potentially last you the rest of your life. Dental bridges tend to last 10, 15, maybe 20 years on a patient that's a good patient, comes in regularly, gets their teeth cleaned, brushes and flosses at home. In reality, that's not most people. And generally, they tend to get replaced every 5 to 10 years. Partial dentures are another option for replacing teeth. They are mostly supported by gum tissue often, and we basically call them show teeth. Patients are not really able to chew meats and vegetables and fruits, nuts and things like that when they have a removable prosthesis that's born just by gum tissue. So in my opinion, and the opinion of many other dentists, the best restoration for replacing missing tooth is a dental implant.